Hello, everyone. Thank you so much for logging on to today's webinar, Living Well Online Health Series, Taking Care of the Basics, Wellbeing in a Stressful Time. This web series is brought to you by 5210 Plus, Gallatin, and Bozeman Health. My name is Danica Comey, and I work at Bozeman Health as the Community Engagement Coordinator. We're so excited to be offering our online Living Well Health series, and sincerely thank you for your time and your engagement for this series. Please check back onto Bozeman Health's website, which is bozemanhealth.org/community education, to see our upcoming Living Well presentations. You can also follow us on social media. We have Facebook and Instagram accounts for both Bozeman Health and 5210 Plus Gallatin. Ellie Martin of Route Finder Consulting will be presenting on behalf of the Resilience Project at Greater Gallatin United Way. She's a skilled mental health clinician, a systems-oriented change maker, and an invested collaborator with individuals, organizations, and communities in the pursuit of well-being. Her trauma-informed approach is rooted in the importance of how relationships are critical for our healing. She holds some simple truths. We are all doing the best we can. There is always opportunity for growth, and our past is not our destiny. So now it is my pleasure to turn the presentation over to Ellie. Thanks so much.
Thanks so much, Danica. I appreciate being able to be here with all of you. And so I'm excited for being able to share some information that could be useful. So today, as Danica said, we are going to be talking about how to take care of the basics, primarily around well-being in a stressful time. And I'd imagine that everyone knows what I'm talking about when I talk about stress at this time. So just really glad to be here, and I'm psyched that Bozeman Health is offering all these cool learning opportunities for us in the community, because I think we all are looking for information to help us make sense of this unsettling time. So I wanted to share a little bit about the Resilience Project at Greater Gallatin United Way. It is an effort to build a healthier and more resilient community where our behavioral health and our mental well-being are seen as being as valuable as our physical health. So it may be helping to shift the collective mindset towards acceptance that we're all doing the best we can, and we have some opportunities for normalizing mental health and well-being as something that we all experience. So Danica gave a nice little intro of who I am, a little bit more basic info that might help you. I'm a licensed clinical social worker, and I currently focus on professional development and behavioral health consultation with programs who serve children and families. And I also provide some clinical supervision to clinicians who are seeking licensure. And I have a broad background that has brought me where I am today, and it includes lots of mental health treatment and wilderness therapy and expedition experiences with various groups. So understanding why we all do what we do and how we sort of navigate the world. So those are some of the things I have always been great teachers for me. So our plan for today is really to talk about stress and define it and understand it, and then think a little bit about how to regulate the nervous system and how that's a really valuable part of making sense of how we're sort of dealing with this constant onslaught of changes in information, recommendations from various health departments and the CDC and Bozeman Health and everyone else who is trying to provide really valuable information for us, and knowing that the news is maybe a source of overwhelm as well. So just knowing that we are in a state of constant arousal about the way we're navigating right now. And so we'll spend some time on that, and then we'll move into talking about some really simple strategies that can help us to remain regulated, or at least focus on well-being in a very kind of structural way that might be helpful for us as we move forward. So I want to acknowledge a variety of things as we start. And as you can see here, This is a time, and as you know, this is a time of prolonged stress that may outstrip our current and typical coping skills. We may be feeling a variety of emotions that range from grief and fear and sadness, all the way to feeling determined, appreciative, joyful, and meaningful, or having sense of meaning. We may be worried about our health and our finances, and the health and finances of other people in our families and in our community, or in the broader world. We are not immune to seeing the level of distress that people around the world are experiencing. So it's true that these are all normal responses in a truly abnormal time. I've heard people say recently that the phrase "the new normal" is almost like ignorant of what we're experiencing, because there's nothing normal about what's happening. So it's all new, and our emotional responses perhaps are normal when faced with something completely uncertain and scary. So I'm just thinking about this being a truly abnormal time, and knowing that we're all navigating it to the best of our ability. So it has been helpful for me as I look at the last 14 weeks since we've sort of been navigating COVID-19 in our community, in our world, to think about getting back to the basics. With that, practicing compassion for ourselves and others, and adjusting our expectations for what is reasonable right now. There are a whole lot of different ways we can sort of imagine what we're capable of doing, and it's helpful to know that when we are in a state of stress or experiencing stress chronically, our body and brain's abilities to accomplish tasks in the same way as when we are not stressed actually gets stretched. And it's something we just need to be sort of aware of, so that we're giving ourselves permission to set more realistic expectations for what can possibly happen at this time. So hopefully those acknowledgements sit with all of you in a way that resonates. Okay, so we're going to start a little bit with a recap of 8th grade life sciences class. I know that some of this stuff may be more familiar to you based on your professional history or background. I know for me, I had to sort of kind of tap back into some knowledge to help me understand stress by looking at how our nervous system is wired to respond to it. So a little recap, you know, our nervous system is divided into 2 parts. We've got the central nervous system, which is consisting of the brain and the spinal cord. We have the peripheral nervous system, which is consisting of the autonomic and somatic. And then as we look at both the autonomic and the somatic, both of those get divided into 2 parts as well. Autonomic is what regulates our sort of self-regulation, or controls our self-regulation actions within our organs and our glands. And those 2 parts include sympathetic, which is about like activating or arousing, and parasympathetic, that helps our system calm back down. Our somatic system is all that stuff that we are sensing and feeling in the environment. So all the stuff that comes in and all the stuff that we sort of put out through body motion. So much happens in our bodies without our thinking about it, and it's all in response to what we experience. So it's really kind of helpful for us to be thinking about how a lot of these systems are deeply involved with how our body reacts to change. And right now, we are constantly reacting to change in our environment. So we'll kind of keep looking a little bit more fully into that. Okay, so in Montana, this type of stress might be encountered on our favorite trail in the Absarokas or in the Gallatins. And there are a whole bunch of different things our body and our brain would do if we were to see a grizzly bear on the trail, right? So the human body is hardwired to react to stress in ways to protect us and keep us safe. The neural pathway of our fear response is then tightly connected. So a tiny region at the base of our brain sets off an alarm system and releases first adrenaline, and that prepares our body for action. It increases our heart rate and our respiratory rate. And after a little bit of time, we produce another chemical called cortisol, and that sends glucose and sugars to our brain for fuel. And it also increases these substances that kind of hang out on the outside of tissues that can be sort of sent in if we were to be injured. So our body is doing all of this preparation in the event that we could be injured or are in some way unsafe or in harm's way. So the cortisol also shuts down some of the non-essential functioning strategies that our body usually is going through, like digestion or some of our reproductive activities. And all of those things happen because they're not needed in the moment of trying to keep ourselves safe. So we are designed to endure stress for about 20 minutes at a time. And that is because that's about the lifetime of adrenaline. And cortisol itself is a longer acting chemical. It is usually around 40 minutes lifetime, and it has a little more complicated shutoff process. But when we think about it, 20 to 40 minutes feels reasonable to be fully aware of our surroundings, have a increased kind of heart rate and respiratory rate, and having our eyes dilate in order to be able to see really well and be able to kind of like pay attention to our surroundings and know how to respond if we see a bear. So if we avoid the bear and we stay safe, great. But what if the bear has moved into your house? What if you're having a hard time getting away from the bear? What if you don't see a solution that allows you to get your system back on track or get back into a state of calm? And I would say that our bodies and brains have been responding to COVID-19 the same way that we would respond to seeing a bear on a trail. It almost doesn't matter what the threat is. Our bodies are so wired for that fear response that it takes over without us thinking about it. So I want to acknowledge that cortisol and adrenaline have perhaps been pumping through our systems for the last 14 weeks or longer. And we may not be getting our parasympathetic nervous system back on track as well as we would if we were having some respite from the source of the stress. So just acknowledge that perhaps right now we've got a bear living in our house and we have to do a little bit more active recovery to help our bodies navigate the difficulties of this time. So that brings us to just looking a little bit more at the definition of stress. So this work comes from a variety of folks, but this has resonated with me because we think about stress as our body's reaction to change. And then if you sort of tease those two things apart, we have both the source of the stress, which in our case is COVID-19, or it could be a health issue that you're navigating with your physician, or it could be parenting, or it could be finances, or it could be employment challenges. And so we have a variety of sources, or it could be housing insecurity. There are a variety of sources of stress that we're all navigating at any time. Knowing that we've got COVID-19 happening within our world, that is an added huge amount of stress, right? So that's a source of stress. And then we also can look at the response to stress. So in this case, it'd be the physiological, psychological, and emotional ways that we try to make sense of and then tolerate the stress that we're experiencing. So when we have little control over the source of the stress, we need to focus on what we can control, as well as support our body's ability to respond to the stress in hopes that we can recover and benefit from the work we're putting into navigating this challenging time. So sometimes when I think about stress and kind of the body and how we're working, and we've just done this little recap of the nervous system, I like to share the hand model of the brain so that we can have a little visual for folks around this work. And so this work comes from Dan Siegel, and it's just a way for us to make sense of like the parts of our brain that are in charge of different actions, because it may help us be more aware of how we might be making decisions and navigating some of this time. So if you think of your wrist as your brain stem, this is where a lot of primitive activity happens in our body that we definitely aren't thinking about. This is often the sort of heart rate, respiratory rate, like how your blood pumps through the body and moves through the systems, and how you're regulating temperature. Some of that, it happens within the brainstem, and we're definitely not able to make tons of change within that activity. As you move up, and as you see, my thumb is sort of wrapped around, or my fingers wrap around my thumb. My thumb is representing what's called the limbic system, and that's the emotional center of our brain. And this is where memory and like emotional response and how we sort of navigate feelings, that's really sort of what our limbic system does. It also is in charge of the release of a lot of hormones, and is in charge of our fight, flight, and freeze response that we just talked about in terms of the sympathetic nervous system helping to keep us safe. So this is the limbic system, the emotional center. And if you think about the fingers of your hand, they're representing the prefrontal cortex. And this is where all of the higher level thinking that makes us human is happening. So there's a lot of kind of critical thinking, some more complex memory work happens up here, kind of like long-term storage, lots of like hearing and communicating. A lot of the work around that happens within the prefrontal cortex as well. So if we think about our limbic system being in control of physical balance, temperature regulation, digestion, hormone regulation, mood, heartbeat, sexual behavior, it has a lot of skills, even if it's the emotion center, right? It's not higher thinking. It's vital for learning and memory and reward reinforcement, but it's so vital to the fight, flight, and freeze response that if that is all it can operate from, it means that we have really flipped our lids and don't have as much access to this higher level thinking. And we're sort of like humans walking around with our emotions guiding everything that's going on for us. So when we're stressed, the limbic system is in charge. And our goal is to figure out how to bring our prefrontal cortex back online throughout the day at some point, because that helps give our system a moment to sort of relax and pause and regain kind of a baseline of rest and digest, as we would hope the parasympathetic part of our nervous system is able to sort of get us back on track. That's a little bit of a recap around stress and our how our brain and nervous system is involved in that. So I'd like to move us to thinking about some activities that we can do to support ourselves in a stressful time. And this work comes from Elizabeth Markle and her colleagues at Open Source Wellness, and they talk about the 4 essential nutrients. And the 4 essential nutrients are move, nourish, connect, and be. And in a time of great stress, while we are trying to make sense of so much going on around us, it can be really helpful to distill down what we should be focusing on to a small number of things to remember. So fortunately, I'd imagine that most of us have already been incorporating a variety of these 4 essential nutrients into our daily lives. And there may be some additional strategies around these 4 concepts that can help us to feel even more calm or resolved as we face the stresses day after day. So I just want to go a little bit more deeply into each of these. So for move, we're talking about physical activity, and this is some way to get your body kind of moving through space. And it doesn't have to be taking up lots of room. You don't have to go anywhere. There are a variety of ways that you can make that happen, right? For nourish, what we're talking about here is eating healthy foods and having access to healthy foods to to keep our bodies operating in a way that is keeping us safe. Connection, what we're talking about here is having the ability to be seen, heard, and understood by someone else. So knowing that if we have access to a support system, that we feel these ways when we are engaged with that support system, that is an essential nutrient for our ability to feel well. And that's because we are connecting beings, right? Humans are built around relationship. And the fourth essential nutrient is the concept of being. And this is really about taking a pause. So we have a few ways that people have been thinking about and doing these 4 different essential nutrients over the last 6 to 8 weeks since I began talking about this with groups of people. And so here are some examples within each of these different categories. So for moving, we may have had some limitations during our shelter in place that could have impacted access to our typical strategies for movement. So we may have had to develop some new ways to get the exercise that our body needs, or we may have had to really simplify how we're doing that. So maybe walking has been part of your plan, maybe some like seated exercises that are guided by a physician or a physical therapist. Perhaps you utilize some YouTube videos or some form of virtual workout classes. Those have really proliferated over our time in sheltering in place, even now as the states begin to reopen. And then any ways that you move are going to be helpful for getting the blood flowing and good things happen to you when you do that. So I'm sure there are other ways that you all think of for movement for yourselves. Perhaps it's playing tennis, perhaps it's riding a bike, all sorts of different things. For nourish, I think about having enough food to eat, so access to healthy food and the ability to cook the food, as well as access to drinking water that helps your body to sort of work through all the systems that we rely on. It also refers to monitoring our consumption of caffeine and alcohol. Both of those have really different reactions in our bodies, especially when we're stressed. So what we may do in a typical time might not be something that we can continue doing when we are experiencing high levels of stress. So part of it is about paying attention to your body and seeing what's feeling good and what's not, and adjusting to try to get to a place where you can kind of feel more calm as well. For connect, I think sheltering in place has created a variety of barriers for people to feel successful connecting with the people that they love. So we've had to be really creative in overcoming some of those barriers. And I want to acknowledge that there are both formal and informal strategies for connection. They might be related to professional work life. They could be related to a spiritual sort of faith-oriented group that you participate with. It could also be a personal support structure that's really valuable to you. And it's figuring out ways to still connect despite some of these social distancing, or in better words, physical distancing expectations that we have as a way to reduce the spread of COVID-19 or coronavirus that can cause the disease. So you may have some experience doing some virtual meetings with friends or playing games on, on Zoom or whatever platform you have found to be successful in connecting with the people you care about. It still could be a traditional phone call. There are still ways to meet people in person and do so safely, especially as the weather warms up and we can spread out and have a picnic and be outside. All those things can be really great ways to still connect. And then fourthly, the concept of being is really an option that is either passive or active, but the goal is to take a pause. So however that looks for you, I emphasize the value of sleep for our health and well-being, because it's an opportunity for our brain to really kind of clear out all the things it doesn't need. I think about all of the different ways that people engage with their passions. So there could be some crafting or artwork that allows you to really get into that paused place. Could be singing, could be sitting quietly or walking in the woods, and the goal being that you're just paying attention to your surroundings and focused only on the present moment. And sometimes that's also referred to as mindfulness meditation, or some spiritual practice involving prayer. And all of those are great ways to be. And there's no one way or one better way to do any of these things. So when I think about the essential nutrients, I'm really just trying to think about, okay, what are some easy, non-stressful ways for me to incorporate something that fits into one of these categories, especially as I'm really seeking some form of structure to my day that may have been really shifted because of a change in my work environment or in how I access my professional community. So I know for myself, I've really benefited from creating a schedule for my day, and I think about how I fit these things in. I write in my schedule when I'm going to have breakfast and lunch and dinner, and I think about when I'm going to be moving my body and taking little breaks throughout the day. I also think about my week and where I can fit in moments of connection, either daily or weekly. And then one that is more challenging for me because it requires me to really take that pause, but it's so valuable to do so, is finding intentional time that I schedule for being and pausing. And so I have really valued being able to kind of think about how I'm kind of moving through each day, and using these as good little benchmarks as I go. So we don't know when, if, how COVID-19 or other stressors in our lives will continue to affect us. We do know that there are things that we can do to feel better. We also know that it can be an amazing time for innovation, learning, and personal growth. And everyone's abilities in any of those categories are unique. So not everyone is going to be innovating. Not everyone is going to be turning inward to focus on themselves. And the beauty of a community is that if everyone leads with their strengths, we have the opportunity to imagine new possibilities. So everyone doing what works best for them and how to get through this time together is really what we can hope for. I've heard it many times said that this is a marathon, not a sprint. I don't even think it's a marathon. I think we just have this thing that is going to last a long time that we don't know how it's going to last. And so regardless, we need to pace ourselves. And focusing on the basics can really be helpful for us as we try to sort of keep track of things that are most important right now. And so if we take care of the basics, we really need to give ourselves permission that that's enough. So to wrap up, I want everyone to think about one thing you can take away from this session and apply this week. It could be from something that I talked about on the neuroscience at the beginning, or how our stress response system operates. It could be around the 4 essential nutrients, or choosing just one of the essential nutrients that really is either easy for you to do and it helps you feel some sense of mastery, or it could be focusing on one of the essential nutrients that is hardest to fit in. So maybe you give yourself a little encouragement to try something and be curious if it feels any better or any worse at the end of the week having tried it. I like to think about all of these things when we think about well-being and self-care as like opportunities for sort of curiosity and playfulness around new things and open-mindedness. And then really saying like, it worked or it didn't. And it's okay if it didn't, because everyone's different. So there's going to be something that does work for you. And so I encourage you to pick something that you're excited to take away from this session and apply this week. So thank you very much. I look forward to hearing from you. If you have any questions, my email is right there at the bottom. On behalf of Greater Gallatin United Way and the Resilience Project, I really appreciate you spending some time with us, and knowing that everything we do to think about feeling better, and then that will trickle into us being able to feel better too. And that's what our community needs right now. So take care of yourselves.